This forum, I'm the health coordinator between Spotlight and government who run this facility. This facility is serving a very underprivileged part of the community, and it has done a very great service in that monthly we deliver more than 100 babies, and we see up to 550 antenatal mothers. For outpatients, we see 1,500 patients, and so we are really serving the community. What we are doing today is commissioning the theater, which the funders equipped, and it is fully equipped and it's ready to serve, and the city health office in partnership are willing to support us and give us the staff. So we really appreciate the government for the work they are doing, and even our funders and the team here in Uganda, Spotlight on Africa Uganda Foundation, for all the work they are doing by putting up these great structures to serve Ugandans in the health sector. Challenges in that we have to refer our mothers who have complications to the Bale Referral Hospital, which the distance is a bit long, and also the forest. Sometimes the road is very, very bad, but we have a tukutuku ambulance which we use to transfer them. And we want to say that we are very proud that we've never had any maternal death in this facility for the 3 years we've been operating, and we've not also. And we need the staff that were employed by the Spotlights. We have a lot of staff here, and that burden is keeping the funders from being able to complete the other structures which they want to complete. So we need staffing, we need the supplies so that the work goes on smoothly and we can serve more Ugandans, and also support the main hospital to reduce their burden of care.
Our singular prayer to government now, both the city and the Ministry of Health and Government of Uganda, is to elevate this Health Center 3 to now Health Center 4, because it has now met the minimum requirements and other policy protocols as put in place by Ministry of Health. Because they think of the Ministry of Health that once you get the theater that is ideal for operating mothers, that one qualifies a facility transition from Health Center 3 to Health Center 4. We've been around struggling, but I want to thank our partners that at least have helped to ensure that we get such services here. 4 districts. It serves Budaka, it serves Mbale City, it serves Mbale District, and it serves Butaleja. So it's a very big health facility serving the cosmopolitan community made up of Indians. The other time, today in the morning, I saw at the facility Indians, the Chinese, that is their health facility, the ones in the industrial park. So it serves a number of Basoga, Baganda, but as I said, from 4 districts, which necessitates for it to be urgently, with immediate exigence, to be elevated to Health Center 4, in line with the protocols laid down by Ministry of Health, that once you get the theater, the amphitheater, or the machines that are ideal in the operations, you transition. And I want to report, using Voice, NTV, and other media platforms, that yesterday, we had a mother who was successfully operated within the theater. So it is a congrats to our team, it's a congrats to the community, and a congrats to Spotlight Africa, the Mbale City Council, and we have now the machines, we have the facilities, we need manpower, we also need extra buildings for so that it's able to fit the status of Health Center 4. But for now, we can go to Health Center 4, then these other buildings and extra manpower can be rolled over. Then additional funding so that we are able to realize the objectives of the Ministry of Health and our people, yes. The Mbale main has been very far. You know, our people don't have a lot of incomes. So even getting a Bajaj of 3,000 to Mbale main is very far. The facility which is meant to serve the local community, the Bacholi, as I said, the Banyole, the Bataleja, the Bamasava there, and the Chinese from the industrial park. I saw we have about over 100 Chinese in the industrial park. This is their facility. The Indians, that's their facility. So let's ensure that it is supported to serve all of us properly.
The population. And within this, what have we so far achieved? Through the Vision 2040, this country declared that they are going to have access. They will improve access to health facility for the population of Uganda, and that health facilities will be in a radius of 5 kilometers. And as I speak now, the health facilities we have built is about 91% of the population are able to access health facilities at 5 kilometers. That's a very great achievement. With only few other areas which are hard to reach, like Karamoja, like in cattle corridors, that 9%. I believe the next 5 years, every person in this country will be able to access health facilities at the radius of 5 kilometers. We have gone ahead as Minister of Health. In the area of specialization, we have regional referral hospitals. The number of regional referral hospitals has now increased up to 16. And you have one here in Mbale, which is a regional referral hospital. A regional referral hospital has specialized care. And these facilities, health center 3s, health center 4s, are supposed to handle these other normal cases, leaving only those who require specialized care to be in the regional referral hospital. And we are so glad that through the partnership, we are able to now change this to Health Center 3, which is very functional, and also with the comprehensive services for maternal child care. Thank you for the team for that. Not only that, we also have specialized hospitals. As a country now, we are looking at the disease burdens. We have a specialized health facility for cancer. And these specialized care and services are even now being extended to the regional referral hospital. Mbale is one of them, and we have already started the process of having fully-fledged cancer services within the regional referral hospital. In Arua, in Barara, we are starting with those. Those are progresses, because these cancer diseases is now everywhere. And we feel we should be able to even embed them in this regional referral hospital. Not only that, we have Heart Institute in Uganda. And this Heart Institute is able to work with the regional referral hospitals. They occasionally come, they carry out camps to address those issues. Not only that, we have as a country, we say every constituency should have a health center 4. And as we move now, we're almost over 60%. We cannot complete it this time, but these are tasks is going to be completed. The country is able to put Health Center 3 in every sub-county. And you must be very happy that in this area now we have 2. And there is a reason why, which you ask, should be able to work on, so that one of them can become a Health Center 4. So, as I speak now, even the Health Center 2s, which we used to have been now elevated to Health Center 3s. We have 400 Health Center 2s, which has been elevated to Health Center 4. This is not a story, and you appreciate and internalize. These are services to bring health services closer to the people. And when health services are closer, people will be healthy because they'll be seeking for services. And when they are healthy, their production will increase, because you will not spend money in treating malaria, you will not spend money in treating hypertension and others. We are nearer, and blood bank is one of the
game changer to resolve the issue of maternal child. Many of these mothers end up with what we call postpartum hemorrhage, and they die because of the excessive bleeding after birth. But we have gone ahead to establish different blood banks in Arua, Male, Soroti, and others. Not only that, we have ambulance services which are also put at regional Faro places. And we have a plan and which is being implemented. Every constituency, Honorable Your My Witness, is getting an ambulance. That is government effort. That is implemented through Ministry of Health to see that for those who have complications can easily be taken to higher level and worked on in time so that we save their life. So those are really what commitments we made. I'm very happy. I want to echo that we are very grateful to the family of Rees. You mentioned it very well. Puppet is a very, very close ally to this country. We can't deny that. And his discussion with His Excellency is transformed through the health institution. And we are able, through you people, you are doing what you are doing is on behalf of the collaboration we have with the UK government. And we are very grateful, we appreciate. We are also very grateful that the lifting of this is a model maternity center, not ordinary. Because when you mentioned the comprehensive packages, which is very, very key, and I will now urge you, away from the maternal child, and you add adolescent, because these are young people. They are growing. We'll save them at birth. We'll save them when they are children. But after 5 years, after 10 years, they are growing. And we are losing them out because of so many other issues. So many other issues. So as part, can we add? And another very important structure we have at community level, which doesn't have facility, are the VHTs. My dear VHTs, thank you so much. These are people who are in the health structure, but they work without facility, meaning that they're always available. We have two phases of community workers. There's what we call CHIUs, Community Health Extension Workers. And these are being placed at Paris level so that they work hand in hand with the VHTs. These are very strong people. Please carry out with health education and health promotion, because health is being made at home, not at facility. Do your part such that the people who will be coming here will come specifically for specific services, and also continuity, because as part of your role, you're supposed to identify pregnant mothers, send them here as early as possible, and then also when they go back, you're supposed to visit them from the 3rd day, from the which other day, if you are doing it.
3 years, an operating theatre, and I'm very pleased to say we have met that commitment. And so we have fully equipped that operating theatre about 2 months ago. And we were very grateful that it was Lord Poppet, who's the UK Prime Minister's trade envoy to Uganda, a very close personal friend of President Museveni, who, when he came to see this maternity centre in April of this year, he said, "What do you need?" And I said, "We need equipment for this operating theatre." And then he personally donated all the money for that, after his dear wife, Lady Poppet. And you'll see the sign when you go and visit the operating theatre. It's named after her. Because when we started this health facility, it was many years ago. we started with a CHIP program, so a community health program, about 12 years ago. And we, as the Deputy RDC has said, we have trained 250. And all those 250 community health promoters are still with us, still supporting us, still working in their communities, doing a great job. And thank you for that. 7 years ago, Richard Okotel took me here, to this land. And we'd previously built the Masoto Christian School, which is just 500 meters away. And he said, this is where we want to set a health center. And so we walked the land, and we prayed on the land, and we agreed we'd buy the land from this old Muse, who gave us the land on a very cheap price, because his son wanted to go to medical school in Kampala. And so to pay his fees, he sold this land, believing that a health center would be here. And we kept our promise to that old Muse. And we built the Level 3 Health Center some 7 years ago. And we went into partnership with the Mbali Health Department. And they have been very good partners over all those years. And so we honor the City Health Officer and all of his team today. Thank you. Health Center every year. And they get all their services for free. And that is a strong partnership we have through the City Health Office and through Mbali City. And so we're grateful for all the leadership of Mbali City for the support over all those years. So thank you, dear partners. That as donors in the UK, we can't take on all of the operating costs of such a place as this, which is why we need to work closely in partnership with the Ministry of Health in Kampala and obviously the City Health Office in Mbali. So we ask you as leaders in healthcare for the whole of Uganda to come together, to work together, to find a budget that will suit this place, that will enable this place to continue to grow. Because our ambition is to deliver 3,000 babies every year safely. And we have the capacity to do that. So with your friendship and partnership, we'll work together to deliver. Thank you.
We are happy. We appreciate. I think those are the underlining words that I would begin with. Evans, the London team, we are very grateful as government that you are partnering with government in doing this work. When I've said this, because I was posted here 4 years ago, but I'm a regular visitor to this place here. If you just open their book, their visitors book, almost I come here thrice in a month to check on the facility and how work is being done. I can say now, I can confirm and reaffirm they are doing the perfect job these days. But why I used to come and check on them those days when I just come, there were issues. But they rectified all the issues with the new management that is in place. So please continue. The sky is the limit. This maternity ward and the health center, but they have also gone ahead and trained the VHTs. They have around 250 VHTs. And I've visited them on several occasions, wherever they are, and they have facilitated them with the tools of work. They have the gumboots, they have the uniform, and they are doing great work. And they are being, every time they have refreshers course, they call us and we come and talk to them. And you see they are very happy people. These people who had lost hope, but you find the mothers, all the people in the village there, doing great work. But this is all attributed because of spotlight on what? on Africa. They are told, they are given the knowledge to handle the villages. The villages around here, not even only here, but you go as far as Bukema, Navitiri, Marare, Masanda, and others. They are benefiting from Spotlight on Africa services. Not here, but even where they are living. As a theater, I think things are going to be now very well. They are going to be very good. They have improved. Actually, I would encourage the mothers to continue even producing this thing. No, because now it is going to be very easy. If you are defeated the other way, you can go to the other way. And what do we need in Uganda? We need the population, because there are also diseases killing people. I know scientists